Hello, I'm Julie Clark, and I teach the hypnobirthing courses for pregnant couples. Most pregnant couples come along from around about 25 weeks. They'll come nice and early if they're feeling quite anxious, or if they're super busy, they might put it off until the last minute and come through at around about 35 weeks. So it's totally up to you. You can come anytime you want to, from as early or as late as you want to. The important thing, though, is try to leave yourself about a month after the class to allow for practice time. So keep in mind that you could actually go into labour anywhere from 37 weeks to 42 weeks, which is totally normal, and that's absolutely fine. But it's also very important to give yourself literally some breathing space. So what is actually taught in the hypnobirthing course, I take you through the important breathing that you need to use during your labour. And the reason that you want to have some practice time is so that you can practice that breathing, become very fluent in that breathing. It becomes extremely easy. And then as soon as you go into labour, click, there you go, you're onto your breathing straight away. So it's important to have that aspect. That breathing is designed to trigger your deep relaxation. So again, I explain all of that in the course, in the session. It's just a one-day course. Originally it was 5 weeks, 3 hours per week. And then I shrank it down to 2 days, 2 sessions. And then, of course, COVID happened, so I had to shrink it down further. So I've actually been able to shrink it down to 1 day. So we started around about 9 in the morning and finish around about 4 in the afternoon. And in that time, I'm able to convey to you and share with you so many incredibly important concepts that can make a world of difference to your labour. So the first one, breathing, we've talked about. The second one is the relaxation. So if a woman is extremely tight and tense, of course it's going to escalate her pain, and that tension will actually make her pain so much worse. So there's an old adage, fear causes tension, causes pain, and it's a cycle. And what we're doing is breaking that cycle to help you have an extremely comfortable birth, a much more straightforward birth, and a very time-efficient birth. So that's all been found with the hypnobirthing techniques. When you use the breathing and it triggers your deep relaxation, then it helps your body to put all the energy towards the uterus and have a very time-efficient, much more comfortable labour and a much more comfortable birth as well. Oxygen flows better through the woman's body, and of course, that's a massive benefit to your baby as well. So when you're looking for a very time efficient and very comfortable and very safe way to give birth, then it is evidence-based that hypnobirthing is the way to go. I also teach you special massage techniques. Well, not to the pregnant woman, of course she's not massaging herself, but I certainly share that with the partner and I guide the partner through that. So we do that for a while, and then the partner is well equipped to be able to help her through the labour too. So the partner comes along, of course, and if you have any extra support people, they're welcome to come along as well. And we go through the breathing, the relaxation, and then very importantly is the mindset. And in that mindset is pushing aside fear. Now, there's no point saying to somebody when they're actually in labour, hey, don't be scared. Hey, focus on your breathing. Hey, just chill. No. The labouring woman will punch them in the nose if they say that to her. What we need to do is prepare much earlier during the pregnancy, make sure everybody's on board. We know exactly how we're going to do this. We've planned, and then the chances of achieving exactly what you want are actually very, very high. How do we know this? Well, it's because thousands and thousands of people have done hypnobirth right across the world. If you have a look at this in the USA, it's enormous. In the UK, it's so popular. And certainly here in Australia, we've had it for decades. Obstetricians are aware of it, they fully endorse it. Midwives are very aware of it because they're usually the ones that are with the women most of the way through the labour. Can the midwife just help you learn hypnobirthing when you're actually in labour? No, it's way too late. It would actually slow the labour down to begin to try to explain all of this if the woman was very activated in her frontal lobe, very cerebral through her labour, then it actually slows the labour down. So learning it beforehand, having a good understanding of it, and of course it's not rocket science, it's incredibly easy to learn. And the way that I teach is very quick, it's very efficient, it's incredibly easy. There is no stress, and you can see the classroom right behind me here, incredibly comfortable, very private. It's in my own home, and the seating is incredibly comfortable. So actually what happens for a lot of people is that they come in and they sit down, and they're often a little bit unsure at first for the first 5 minutes. Within 20 minutes, they've learnt something and they're actually amazed. They're so surprised with, oh, I didn't know that. And once they start to learn things, and of course I explain things in a really positive way, and because I've had my own two babies, I understand how people want certain information up front. Explain these things to us now that we understand that. Now we're open to more layers of information. So it's not rocket science. It's actually incredibly easy to take it all on board. I've been teaching it for years and I know exactly how to get this information across so that it's very easy, it's very doable for you. Then once we've completed the course, of course, I also give you handouts, but also a wonderful book by Sophie Fletcher. She's a doula in the UK and a hypnobirthing instructor there, and she's very skilled. Her book is extremely easy to read, and I've read all the hypnobirthing books, and this is the one that I think is actually the most positive and certainly the easiest to read for pregnant women. Partner probably won't read this, maybe they do, but otherwise what we do is pull together a birth plan, which you'd call a rehearsal plan or a bit of a script, and then convey all of that to partner. So I help you with all of that in the background as well. So I send you an email upon your booking to give you a bit of guidance for a couple of things for you to have a quick look at before you come to class. Then when you're in the class, I'm talking to both of you equally, so I very much respect to include the partner. And then after the course, I'll send you a follow-up email with a whole bunch of links that you can just click on quickly and easily, and that helps you to pull this together afterwards as well with a birth plan, etc. Affirmations and visualizations. In the actual course, I have a PowerPoint presentation, and you are allowed to photograph any of those slides that you want to, but also I get you to record the visualizations that I do with you. So my voice kind of goes creamy when I'm doing the visualizations, and it sounds like, and when you're ready, allow your eyes to gently close. And the first one is only about 10 minutes, the next one's about 20 minutes or so, the next one's about 30 minutes, and you actually get to record those and keep them on your phone so that you can listen to them continuously whenever it suits you throughout your pregnancy, and that becomes your practice. That's your homework, to go home and relax. How good's that? So if there's anything else that you'd like to know about the hypnobirthing course before booking in, you're totally welcome to give me a call. Have a good look on the website, of course, that you're on now, but also have a look at some of the information that other people have about hypnobirth. If you need more convincing, ask your midwife, have a talk to the midwife. Now, they're in a public hospital, they're not allowed to actually say you should go and do if it's outside the hospital, but you can ask your midwife, what do you think of hypnobirthing? Do you recommend hypnobirthing? Would you suggest doing hypnobirthing? What did you do when you had your babies? And you'll actually find that a lot of midwives have certainly attended the hypnobirthing course. Obstetricians also are extremely keen on the results, that women come in, they're not screaming the place down, they're very calm, they're very much in control of themselves, they know they're breathing, and they're not freaking out and making everything difficult for everybody. So if you want to ask more questions, you're 100% welcome to call me. My phone number is 0401 265530, and I'll look forward to having a talk with you. Thank you.